So let's start our lecture. So just to give you some historical perspective about the hepatitis viruses. So we used to call it viral hepatitis or divide it as either infectious, and for infectious viral hepatitis, it used to be secondary to hepatitis A virus, or viral hepatitis secondary to a serum infection. And the viruses that would be transferred by serum are hepatitis B and D. In the past, we knew about the hepatitis A, we knew about the hepatitis B and D, and some of the patients would present with a viral hepatitis-like picture. They will have a prodrome of viral infection, followed by elevated liver enzymes and jaundice, but we were not able to detect them by the regular tests for hepatitis A and B. And we used to call these patients who had a viral-like or viral hepatitis-like illness, but they turned to be negative for hepatitis A and B and D. We used to call it non-A, non-B hepatitis, until we discovered the hepatitis C and E. Does anyone know when was the hepatitis C discovered? حدا بيعرف when did we discover the hepatitis C virus infection? Or can give a guess when was the hepatitis C discovered? طيب, hepatitis C virus, actually it wasn't discovered way in the past. Hepatitis C was discovered in 1989. So before that, some of the patients will present with a viral-like illness, viral hepatitis-like illness, but we did not know about the existence of the hepatitis C virus. We had the tests to test for hepatitis A, B, it would come back negative, and we used to call these patients to have non-A, non-B hepatitis, until we discovered the hepatitis C virus back in 1989, 1990. And then we knew how to diagnose it. And a lot of these patients who used to have non-A, non-B hepatitis turned out to have hepatitis C virus infection. عشان هيك نحن دائما المريض اللي عنده hepatitis C virus infection, we do ask them, have you ever had a blood transfusion before 1990? And that's an important question, because even the blood products that were transfused to these patients were not screened for hepatitis C virus back then, until 1990, 1991, when there was a screening program for blood products for hepatitis C. And the hepatitis C shares a lot of the transmission ways with the hepatitis B virus, so it's parenterally transmitted. Also, the hepatitis E virus was recently discovered, but hepatitis E is enterically transmitted, the same as hepatitis A. This is a table that summarizes the different types of viruses, A, B, C, D, and E. It details the source of virus infection, the route of transmission, and if the patient would have chronic infection or not after exposure to these viruses, and the way to prevent it. And we will go into the details when we present each virus by itself. Just a quick look, hepatitis A and E share a lot of the same criteria. So their mode of transmission is through fecal-oral transmission. And usually they don't cause a chronic infection, with a very rare exception for hepatitis E virus can cause chronic infection in immunocompromised patients. But otherwise, it usually causes acute infection with no chronic sequelae. As far as the hepatitis B, C, and D, their source of transmission is through blood or blood-derived products, or through body fluids. So the mode of transmission is usually percutaneous or permucosal for hepatitis B, C, and D. And these viruses can cause acute or chronic infection. Okay? So let's go into the details of each virus. So the hepatitis A virus, it's an RNA, single-stranded RNA virus. And this is a schematic presentation of the RNA of the virus. It can encode both structural and non-structural proteins. Probably you know more about that from your virology lessons in the basic years. Here our concentration is on the clinical part. So for the hepatitis A clinical perspective, the incubation period for hepatitis A the average is 21 days, but it can range anywhere from 14 to 50 days. This is the jaundice by the age group. So what we need to know is that if we are infected with hepatitis A virus early, less than 6 years, it's rarely symptomatic. So less than 10% will develop jaundice if they get infected early in their age. However, the older the age of infection, the higher the risk of having symptomatic infection. So if you get infected at an age less than 6 years, usually less than 10% of these patients will develop jaundice. However, if you get infected with the hepatitis A virus when you are over 14 years old, then there is a high risk of having a symptomatic infection, and around 70 to 80% of these patients will develop jaundice. As far as the complications from hepatitis A, sometimes the infection can be very severe that it can cause fulminant hepatitis, leading to acute liver failure secondary to hepatitis A. Some of the patients can have a cholestatic hepatitis. So الناس اللي كانوا معي في السيمينار نحن حكينا الفيرال hepatitis or acute viral hepatitis is one of the causes for hepatocellular type of injury. Characteristically, hepatitis A can cause both hepatocellular injury and cholestatic injury. يعني بيجينا المريض عنده infection with hepatitis A, I can see liver enzymes in the thousands, and at the same time I can see elevated alkaline phosphatase and bilirubin. That's due to the cholestatic injury secondary to hepatitis A. There is also an entity called relapsing hepatitis, meaning that the patient is infected with hepatitis A, they will have the acute infection, they can resolve from it, and sometime within the 6-month period following the acute hepatitis A infection, some of these patients may have some sort of a flare-up. They can have a rise again in their liver enzymes, in their alkaline phosphatase. Even they can become sick, not because they got reinfected from the virus, but because of the relapse from the acute hepatitis A infection. And if this happens, it usually happens within the first 6 months. Rarely ever that it happens after 6 months of infection. As far as chronic sequelae, usually there is none from the acute hepatitis A infection. Okay, as far as transmission, so stool is the main source of infection because it's usually transmitted through fecal-oral transmission, and this can happen from contaminated food or water that's contaminated with the hepatitis A. This could be secondary to infected food handlers. يعني خاصة لازم دائما نأكد على الفود هاندلرز اللي بيحضروا الأكل في المطاعم إنه والله to have very good hygiene, especially if they go to the restroom or the toilet, to clean their hands very well before they handle food. Because if you have only one person who's infected in the food handling industry, they do not clean themselves well, they have some fecal particles on their hands and they prepare food, this can lead to an outbreak. حتى نحن عادة أي مريض بدخل عندنا with hepatitis A infection we report it للمينستري اوف هيلث لأنه إذا شافوا إنه والله في بيك في الهيباتيتس A infection وفلان وفي مريض من هون infected, and they can tie it to a common source of infection. يعني كلهم خلال اليومين الثلاثة الماضيين أو خلال الأسبوعين لأنه حكينا incubation period للهيباتيتس A infection is averages 21 days. So إذا شفنا إنه والله صار في عندنا بيك وكان السورس يعني مطعم معين لازم يروحوا يفتشوا هذا المطعم ويتأكدوا إنه السورس of infection مش from somebody who's working within that restaurant. Okay, if we talk about the serology of the hepatitis A infection, زي ما حكينا, it's an acute infection. Usually the virus will appear in the feces first, so we can check for the hepatitis A virus RNA in the feces. This will be followed by the development of symptoms. والregular viral prodrome هدول المرضى ممكن يصير عندهم زي malaise, fatigue, nausea, maybe some mild abdominal pain, low-grade fevers, not feeling well, اللي هو common viral prodrome. Some of them may have diarrhea as part of their viral illness. So these patients will have symptoms, and if we check the liver enzymes during the symptomatic period, they will usually be elevated. So there will be elevation in the ALT during the symptomatic period. During that time, we can check for the infection by testing for the IgM antihepatitis A virus. IgM anti-hepatitis A virus. Eventually, because it's an acute infection, the IgM will go down and the patient will develop positive anti-hepatitis A virus IgG or positive total anti-hepatitis A virus, and this will remain for the rest of the patient's life. And this infection and the positivity of the hepatitis A virus IgG or total anti-hepatitis A virus does incur immunity against the hepatitis A virus. So usually you get the infection once in your life and you don't get reinfected with the hepatitis A virus. For the geographic distribution of the hepatitis A virus infection, Jordan used to be a highly endemic area for hepatitis A virus infection, but because of increased sanity, increased cleanliness, now we are more in the moderate endemic areas for hepatitis A virus. فعشان هيك يعني في عنا good portion of the population that can infected during childhood, but some of the population who escapes the infection during childhood, if they get infected during their late teens, early 20s, they will be symptomatic. وبالعاده نحن يعني كل اسبوعين ثلاثه الا ما يدخل عندنا مريض with acute hepatitis A virus infection. بنلاحظ انه اعمارهم هيك يعني اللي خلصوا توجيهي بلشوا جامعه باكلوا كثير اكل من برا خلال دوامهم في الجامعات من المطاعم المنتشره، خاصه الطلاب يعني they may go to a lower socioeconomic restaurants so they can get infected with hepatitis A virus. Acute infection is diagnosed by the detection of hepatitis A virus IgM in the serum by an ELISA immunoassay. زي ما حكينا, if you had past infection, then you will have positive hepatitis A virus IgG or total anti-hepatitis A virus. هذا بيعتمد على المختبرات. يعني some of the labs will have testing specifically for hepatitis A virus IgG, or they can have a total anti-hepatitis A virus, and this will be positive in case of any previous infection with hepatitis A virus. But to check for the acute stage of infection, you need to test for the hepatitis A virus IgM. If it is negative, then you don't have infection with the hepatitis A virus. إلا طبعا يعني if you come very early, يعني جاي أنت very early في incubation period والsymptoms يعني يا دوب بلشت تصير عندك, so sometimes هذا IgM anti-hepatitis A virus may need some time to appear, and in this case you can test for the fecal hepatitis A virus, which is not very available in the common labs. Okay. Hepatitis A virus treatment and prevention. Symptomatic treatment is the rule. There is no specific medication for the treatment of hepatitis A virus. فعادة هدول المرضى اللي بيجوا ب symptomatic infection for the hepatitis A virus with liver enzymes in the thousands, we do admit these patients to the hospital if they are not able to tolerate the oral intake. يعني كتير منهم بيجي ب severe nausea, vomiting, they are not able to eat or drink, so we admit them, give them symptomatic management, IV fluid hydration, antiemetic medications, help them with their diet until they are able to tolerate the regular oral intake, and we see a trending of their liver enzymes, downtrending of their liver enzymes, so we feel safely regarding discharging these patients. لأنه نتذكر إنه those who have very severe hepatitis A virus, some of them, though rarely, they can develop acute liver failure. Okay. Of course, for the prevention, we need to have attention to sanitation, as we discussed. Some of the travelers, if you are coming from a very low endemic area, such as the United States, Europe, Australia, and you are planning to travel to Southeast Asia, to India, to the Middle East, so you can have pre-exposure vaccination with the hepatitis A virus, which can be administered to high-risk groups, especially travelers to endemic areas. Now, hepatitis A virus vaccine is being offered to the infants, and it's given as two vaccines, 6 months apart here in Jordan. if somebody is infected, if one of your family members who lives in the same house is infected with hepatitis A virus, you as a family member can get a vaccine for the hepatitis A virus. We call it post-exposure hepatitis A virus vaccination, or you can even get the immunoglobulin for the hepatitis A virus, and this should be given within 2 weeks of the exposure. Okay, anyone has a question regarding the hepatitis A virus infection? Okay, no questions. So we can proceed to the hepatitis B virus. يسأل أنا البوينتر واضح عندكم؟ red laser or red pointer?
Yes, doctor, it is.
Okay, good. So let's discuss the hepatitis B virus. So the hepatitis B virus, it's a DNA virus of the Hepatniviridae family. Its genome is a double-stranded genome that has 4 genes. There is the S gene, which encodes the viral envelope hepatitis B surface antigen. There is the C gene, which encodes the nucleocapsid or the core antigen, in addition to the pre-core, or what we call the E antigen. There is the X gene, which encodes two regulatory proteins required for hepatitis B virus replication, and the P gene, which encodes the DNA polymerase. This is a schematic presentation of the hepatitis B virus. So this is the liver. It's replicating inside of the hepatocytes. Some of them will be shedded as a free surface protein, and some of them, most of them, will be shedded as a true virus. وهم نطلع على الفيروس. It has the hepatitis B virus DNA, which is encapsulated by the pre-core protein or the E antigen. وفي عندي أول شيء الكور protein, then the pre-core protein, هذا هو C antigen, هذا هو E antigen, and then eventually the surface protein. Okay, to form the complete hepatitis B virus, which is shed in the serum. The incubation period for the hepatitis B, the average is anywhere between 60 to 90 days at an average, but it can range anywhere from 45 to 180 days. As far as the clinical illness and having symptomatic infection or developing jaundice, like the hepatitis A virus. So if you get the hepatitis B virus infection early in your lifetime, خاصة هدول المرضى اللي بصير عندهم perinatal transmission, so it's very unlikely to have symptomatic infection, and the risk of having jaundice is less than 10%. However, if you acquire or get exposed to the hepatitis B virus later in your life, so the risk of having symptomatic infection is much higher. If you are infected with it when you are over 5 years old, then the risk of having jaundice is 30 to 50%. تمام، هاي المعلومات المفروض متذكرينها من أيام الفيرولوجي. As far as chronic infection بالعكس. So if you get infected early, خاصة perinatal transmission, هدول المرضى أو babies who get infected, usually they don't develop symptomatic infection, they don't develop jaundice. However, they have much higher risk of having chronic infection. On the contrary, if you have the infection later in your life, you are more likely to have symptomatic infection or jaundice and less likely to develop a chronic infection. This is a schematic presentation. هاي المريض develops acute hepatitis B virus infection. If they are develop it through perinatal transmission, so most of these patients will develop a chronic infection, around 90%. However, if you have the infection as an adult, you are much more likely to have symptomatic infection, to have jaundice, and over 95% chance of resolving the infection. جزء منها لها علاقة بالimmunity. So as an adult, you have already a well-established immune system. So the hepatitis B virus, when it infects you, the immune system will be able to detect the hepatitis B virus infection. It's able to detect it, معناته it will fight it. And when it fights the hepatitis B virus infection, ذكروا, it's fighting it inside of the liver, inside of the hepatocytes. So these patients will have abnormal liver enzymes, will have jaundice, will be symptomatic. That's because of their strong immune system. They will be able to fight the infection, control it, and resolve the infection. تمام. بس مشكلة الهيباتيتس بي فيروس حتى هدول المرضى اللي نحكي إنه they have a resolved infection, unfortunately it's resolved from being spread in the serum. بس انتوا تذكروا إنه الهيباتيتس بي فيروس it's a DNA virus. فحتى when they control it from spreading into the serum, already some of that DNA, خاصة هذا اللي اسمه tricyclic DNA, very small DNA, will incorporate itself inside of the hepatocytes, and this may remain for the rest of your life. عشان هيك المشكلة هدول المرضى who gets infected, if their immune system weakens, يعني صار عندهم مثلا advanced malignancy, or they are put on immunotherapy or chemotherapy, هذا small tricyclic DNA virus which are incorporated inside of the hepatocytes will get reactivated, and that hepatitis B virus راح يتنشط again, and it may spread into the serum again and cause reactivation of the hepatitis B virus. عشان هيك نحن مهم أي مريض عنده malignancy, we ask our colleagues in hematology oncology to test that patient for previous infection with hepatitis B virus before putting these patients on chemotherapy, because of that risk of reactivation. As far as the geographic distribution of chronic Hep B infection, to say whether an area is endemic or non-endemic, highly endemic, intermediate endemic, or low endemic, we look at the prevalence of the hepatitis B surface antigen in the population. Jordan, هاي بنطلع if it is more than 7% or 2 to 7% or less than 2%. If the prevalence of the hepatitis B surface antigen is over 7%, we call that a highly endemic area. If it is 2 to 7%, we call it intermediate area. Yani based on the Jordan used to be a highly endemic area, now it's more in the intermediate area. One of the latest studies that was done here in Jordan, looking at the prevalence of the hepatitis B surface antigen, the percentage was around 3 to 4%. So we are in the intermediate. Inshallah, now we have an established vaccination, national vaccination program for children for hepatitis B, and that will help us into going to a low endemic area for hepatitis B virus, inshallah. As far as the concentration of hepatitis B virus, so hepatitis B virus is not only present in the blood, but it also can be present in other fluids like wound exudates. It also can be present in the semen, vaginal fluid, saliva, and that's why there is a high risk for transmission of hepatitis B virus, not only through the percutaneous, but also through the permucosal route, like high-risk sexual behaviors. Mode of transmission, as we said, sexual mode of transmission, especially in people with high-risk behaviors, sex workers, homosexuals. There is a risk through transmission parenteral route, IV drug abuse, health workers who are exposed to needle stick, and definitely we need to think about the perinatal transmission, خاصة في المناطق اللي فيها high endemicity of hepatitis B virus. Perinatal transmission from the mother to the fetus is one of the main modes of transmission. Okay, let's look at the actually this slide here summarizes الكلام اللي حكيناه قبل شوي بالنسبة ل symptomatic infection and chronic infection. So the yellow line represents the chance of having symptomatic infection. The red line represents the chance of having chronic infection. The x-axis has the age at infection, and the y-axis has the percentage of chronic infection. ونحن شايفين if you get infected early during your life, there is a very low likelihood of having symptomatic infection or jaundice, but very high likelihood of developing chronic infection. The older that you get, the higher the risk of having symptomatic infection and the lower risk of developing chronic infection. Anyone can tell me what's the definition of chronic hepatitis B virus infection? مين بيعرف ايش definition of having a chronic hepatitis B virus infection?
هلا دكتور انا انه ما بعرف بالضبط، بس انا كان انه بدي اسالك سؤال عشان اعرف انه اذا هو is it related او لا، لانه شفت حاله مريضه كانت بالعياده hepatitis B.
مين بيسال؟ بس خليني اشوف.
اوكي
ايش اسمك؟
جنى.
طيب يا جنى تفضلي.
انه كان يعني وقتها انا يعني لانه ما كنت دارسته، فانه حكى لها انه حاليا ما في انفكشن انه نقدر نعالجه، بس انه لازم تضلها تعمل صور عشان ما يصير في liver cirrhosis او انه يتلحق بسرعه او شيء زي هيك. I don't exactly understand انه ليش او انه ايش كان الوضع يعني.
ممتاز هذا السؤال. هلا رح تعرفي يعني in few slides رح نحكي على الفيزز of chronic hepatitis B وايش الفيزز that are the best for treatment. فجواب سؤال
فيعني
جواب
هي لا تعتبر انه resolved.
على الاغلب من الكلام تحكي انه مريضتك عندها chronic hepatitis B infection بس موجوده في الانactive phase. فنحن في الانactive phase we don't usually treat these patients.
اوكي.
وهلا رح نحكي على الفيزز اوف chronic hep B. بس نحن حتى نحكي على الفيزز اوف chronic hep B لازم نعرف ايش هي what's the definition of chronic hep B. حدا شاطر هيك سريع طلع على الجوجل جاب لنا الاجابه او عارفها؟
6 شهور.
احمد ايش هو الست شهور؟
عن الفيرست تيست تبعه اذا كان بوزيتيف، اذا اجى مره ثانيه بعد 6 شهور كمان بوزيتيف بعتبره كرونيك.
ممتاز. بس ايش هو هذا التست اللي هو راح يبين لي انه في عندي انا انفكشن من هيباتيتس بي؟
هون سيرفيس انتيجين.
ممتاز اكسلنت. هو الهيباتيتس بي سيرفيس انتيجين. الهيباتيتس B surface antigen is the test that we check if the patient has an active infection now. بس الهيباتيتس B surface antigen راح يكون positive whether the patient has acute or chronic infection. فنحن ايش definition of chronic infection؟ persistence of the hepatitis B surface antigen for over 6 months. يعني اجاني المريض هلا عنده الهيباتيتس B surface antigen positive وعنده حتى positive hepatitis B core IgM، لأن هاي hepatitis B core IgM we check it indicates acute infection. نحكي للمريض طيب هلا أنت عندك acute infection راجعني كمان 6 شهور. بعد 6 شهور hepatitis B surface antigen is still persistent, then we say that this patient مش هلا في الأكيوت، هذا المريض كان عنده acute هلا صار chronic hepatitis B infection. واضحة المعلومة؟
واضح.
تمام. So chronic hepatitis B virus infection is persistence of the hepatitis B surface antigen for over 6 months. طيب لما نعرف هاي المعلومة حنطلع هلا على السيرولوجي. هذا المريض اللي صار عنده acute hepatitis B virus infection and that patient was able to resolve the infection. What's the typical serology of that patient? So after having the incubation period the hepatitis B surface antigen will appear. بس لأنه هذا المريض اللي عندنا هون had an acute infection with resolution معناته الهيباتيتس B surface antigen راح ينزل وراح يختفي within less than 24 weeks after exposure. لأنه 24 weeks are equal to 6 months. So هون we are looking at the weeks after exposure. So these patients who develop an acute infection with recovery or with resolution of the infection معناته الهيباتيتس B surface antigen appeared after the incubation period and then the patient was able to resolve the infection and the hepatitis B surface antigen disappeared within less than 24 weeks or less than 6 months. Because it's an acute infection, that patient will have the IgM anti-hepatitis B core. Eventually it will go down and the patient will develop the anti-hepatitis B surface antibody and the anti-hepatitis B core antibody total. Okay. هذول المرضى usually في they will have positive hepatitis B E antigen. Eventually برضو ال E antigen بيروح بصير عندهم anti hepatitis B E antibody positive. Okay. بنطلع مرة تانية acute infection with resolution we will have positive hepatitis B surface antigen. It will go down within less than 6 months. However, there will be some lag, some time before the patient. يعني إحنا بالعادة ما بيجتمع الهيباتيتس B surface antigen مع الهيباتيتس B surface antibody. Okay. فمعناته السيرفيس antigen راح يختفي. There will be some period during which time before the anti-hepatitis B surface antibody appears. كيف بدي أعرف إنه هذا المريض كان عنده infection؟ Through the IgM anti-hepatitis B core. And during that period, the only thing that would be positive in that patient هو ال IgM anti-hepatitis B core antibody واللي هاي بسميها الويندو period. فنتذكر يمكن انتم لما درستوا الفيرولوجي مريتوا through these phases. فالويندو period هي ال period of the acute hepatitis B infection where both the hepatitis B surface antigen and the anti-hepatitis B surface antibody are negative. اوكي بس بيجيني المريض ممكن يجيني المريض خلال هاي البيريد يعني ممكن يجي abnormal liver enzymes بيجي ب high risk behavior يا دكتور انا عندي hepatitis B ولا لا. we check الماركرز ممكن يطلع عندي both the surface antigen والsurface antibody negative and the only thing that's positive would be the IgM anti-hepatitis B core. فعشان هيك المرضى that we suspect that they have acute hepatitis B infection, we check the hepatitis B surface antigen and also we check the IgM anti-hepatitis B core. Because at the window period, surface antigen could be negative and the only thing that would be positive هو ال IgM anti-hepatitis B core. اوكي بينما المريض اذا جانا in this stage حيطلع عنده both الهيباتيتس بي surface antigen والاي جي ام انتي هيباتيتس بي كور positive. هذا قبل ما يدخل المريض في الويندو period. When they recover surface antigen will be negative الاي جي ام will be negative والمريض راح يصير عنده الانتي هيباتيتس بي كور antibody positive والانتي هيباتيتس بي surface antibody positive. The thing to know انه over time هذا الانتي hepatitis B surface antibody sometimes التايتر تبعه may get low that it becomes undetected and the only thing that can be positive في هدول المرضى اللي صار عندهم hepatitis B infection in the past and they resolve it, the only thing that can be positive or may be positive هو total anti hepatitis B core antibody. فعشان هيك تتذكر هدول المرضى اللي حكيت انه والله صار عندهم acute infection recovered بضلني انا خايف من الرياكتيفيشن فبنطلب نحن من دكاتره الهيمونك not only to test the patient for hepatitis B surface antigen but we also ask them please test your patient for the total anti-hepatitis B core antibody because if it is positive معناته هذا المريض هذا previous infection in the past. إذا هذا المريض بده يمشي على strong chemotherapy we can give them prophylaxis for the hepatitis B to prevent reactivation. تمام؟ What about the serology markers for patients who progress to chronic hepatitis B virus infection? فهذول المرضى بداية حكينا they will have the incubation period كانوا في الacute stage كان عندهم hepatitis B surface antigen positive but because they progressed to the chronic infection that hepatitis B surface antigen زي ما حكينا persisted to be positive over 6 months and this patient has now chronic hepatitis B infection. في الacute stage كان عنده positive IgM anti-hepatitis B core went down صار هذا المريض عنده هلا total anti-hepatitis B core positive. ومعناته المريض اللي عنده chronic hepatitis B virus infection حيكون عنده hepatitis B surface antigen positive والhepatitis B core antibody positive. بالنسبة للإي أنتيجين والإي أنتيبودي هذا بيعتمد على الفيز of hepatitis B virus infection. عادة في early phases بيكون hepatitis E antigen positive. Once they go to the other phases بصير الإي أنتيجين negative والإي antibody positive. طب إيش هم الفيزز of chronic hepatitis B virus infection يا دكتور طارق؟ هدول هم الفيزز وهدول الفيزز لازم تعرفوهم. هلا interestingly مو كل المرضى راح يمروا through all of these phases of hepatitis B virus infection. يعني هدول الفور phases اللي بنحكي عنهم هدول more characteristic for patients who acquire hepatitis B virus early in their life خاصة perinatal transmission. اللي بصير عندهم perinatal transmission للhepatitis B virus, these are the patients that I expect that they will go through these chronic phases of phases of chronic hepatitis B virus infection. عند immune tolerant phase, عندنا immune active chronic hepatitis B, and the inactive carrier state, and then these patients may or may not go through the reactivation زي ما حكينا depending على circumstances والimmunity of those patients. طيب معناته هاي phases are more characteristic of patients who acquire hepatitis B through perinatal transmission. نطلع عليهم phase by phase. نحن هون we are looking through the ALT or liver enzymes. We are looking at the hepatitis B virus DNA and the E antigen and E antibody status. Initially, the first phase is the immune tolerant phase. So a baby gets infected with hepatitis B virus through his mother. Still, the immune system is not well developed. فمعناته هون الهيباتيتس بي راح ياخذ كتير راحته في الريبليكيشن. الهيباتيتس B virus DNA will be very high. It could be in the millions. There is no fighting of the virus. فمعناته الهيباتوسايتس راح تكون عايشه بسلام مع الهيباتيتس بي فيروس. So I do not expect any abnormalities بالliver enzymes. بفايل phase بيكون الاي antigen positive. Okay, so في immune tolerant, the immune system is tolerant to the presence of virus, and that's why the virus DNA will be very high, liver enzymes will be normal, e antigen will be positive. Now through the years يعني هاي بنشوفها هون المريض مثلا بوصل in the mid 20s, late 20s, the immune system is very well established. It's now recognizing the virus. There could be activation of the immune system and fighting of the virus. فعشان هيك بنسميه الاسم القديم اللي انا تركت لكم اياه هون الاميون كليرنس. اذا بتقراوا all textbooks, all lectures, هاي الفيز كان اسمها immune clearance. تغير هذا الاسم من immune clearance لimmune active chronic hepatitis B. So the new nomenclature is immune active chronic hepatitis B. So because of the improved immunity, now we are fighting the virus. معناته we are able to control the hepatitis B virus replication more. So the hepatitis B virus DNA will go down. The elevation هون بطل very high, صار mild to moderate elevation بالhepatitis B virus DNA. Now في inflammation صار بالliver, so the liver enzymes gets elevated. The E antigen is still positive. Eventually, these patients may go to the inactive carrier state. Inactive carrier state. في inactive carrier state, the hepatitis B virus DNA is low. The liver enzymes are normal or mildly elevated. هذا E antigen now is gone. E antigen becomes negative وال E antibody becomes positive. فهي بنسميها ال inactive carrier state. And these patients may remain in the inactive carrier state. فمريضك يا جنى اللي شفتيه في العيادة احتمال انه كان في ال inactive carrier state اللي هو نحن عارفين انه في active hepatitis B virus infection. Surface antigen is positive, بس لأنه الviral DNA is low, لأنه liver enzymes are normal or just mildly elevated, then we don't treat the hepatitis B virus in this stage. The best stages or phases to treat the hepatitis B virus actually لما يكون المريض بالimmune active chronic hepatitis B stage أو بالreactivation stage. Phase 2 and phase 4 هدول are the best or optimal phases for the treatment of hepatitis B. كيف بيجينا المريض هون؟ بيجينا المريض عنده positive hepatitis B surface antigen, عنده viral DNA is elevated, بالعادة بيكون in the thousands, E antigen positive, وعندي abnormal liver enzymes. هون immune system is fighting. فإذا بنضيف medications للimmune system to control hepatitis B, risk of controlling hepatitis B virus infection will be much better. So the best phases to treat hepatitis B هو في الimmune active phase أو بالreactivation phase. إذا إجانا المريض بالimmune tolerant أو بالinactive carrier state, we don't usually treat hepatitis B virus at these stages. نفس الكلام اللي حكيناه هون على الفيزز، بس هون نحن بدل ما نطلع على diagram نطلع على table. بنطلع على E antigen, E antibody, hepatitis B virus, ALT. زي ما حكينا في الimmune tolerance stage, E antigen positive, E antibody negative, DNA is very high, ALT is normal. Liver biopsy, it could be normal or very minimal inflammation. بالimmune active stage, E antigen positive, E antibody negative, DNA is moderately elevated, but the liver enzymes definitely are elevated in these stages. وإذا طلعنا على liver biopsy راح يكون في عندي inflammation, and these patients may even have fibrosis. سؤال نحن كتير بنحبه للطلاب خاصة مستوى رابعة، اللي هو نجيب لكم سيناريو ونجيب نحن serologic markers نحكي لكم how do you interpret these serologic markers. نحن هلا صرنا عارفين المرضى عندهم chronic hepatitis B راح يكون عندهم positive hepatitis B surface antigen, positive hepatitis B core antibody. طب إذا أنا سويت testing طلع عندي positive hepatitis B core positive hepatitis C positive hepatitis B surface antibody, what does it mean? it means that the patient had a surface antigen negative. Surface antigen negative, core antibody total positive, surface antibody positive. It means that this patient had previous hepatitis B virus infection that has resolved. Okay, زي ما حكينا هدول المرضى أحيانا surface antibody titer becomes very low and detectable, and the only thing that may remain positive هو anti hepatitis B core antibody. Also, it indicates past hepatitis B virus infection that's resolved, or could be a false positive hepatitis B core antibody. Okay. المرضى طيب اللي ماخدين vaccination شو بتوقع يكون عندهم positive؟ المرضى الماخدين vaccination وصار عندهم immunity through vaccination. What do you think is positive in these patients?
Antibodies.
Excellent. Hepatitis B surface antibody. That will be the only thing that's positive. نحن أصلا لأنه في الفاكسين نعطيهم inactivated surface antigen. اوكي من غير اكيد لا دي ان اي ولا other particles، بس نعطيهم inactivated surface antigen حتى الاميون سيستم يتعرف عليه and develop surface antibody. معناته those patients who were vaccinated for hepatitis B, the only thing that will be positive هو hepatitis B surface antibody. And that's a way to differentiate it from previous infection، لأنه previous true infection راح يكون عندهم positive hepatitis B core antibody. الماركرز هدول already حكينا عنهم. treatment بالعادة للأكيوت hepatitis B virus we don't usually treat it، لأنه خاصة إذا صار في عندي symptomatic acute Hep B infection most of these patients will resolve on their own. بينما المرضى اللي عندهم chronic hepatitis B virus infection currently we are using the nucleotide or nucleoside analogs, and the first line therapies for these patients اعرفوا أسماء هالأدوية. first line therapy في عندنا الانتيكافير والتينافافير. الانتيكافير والتينافافير are the first line therapies for chronic Hep B infection. زمان كنا نستخدم دواء اسمه الميفودين، بس مشكلة الميفودين إنه it has a high rate of resistance, so it's not used now anymore as a first line therapy for chronic Hep B. Also, we can use the interferon for the treatment of Hep B, but the interferon it has some certain indications to use it. Prevention, حكينا على vaccination. Now we have a national program for vaccination for hepatitis B here in Jordan. If you are not vaccinated, then those patients at high risk for infection, they are vaccinated. خاصة healthcare workers because of the risk of needle stick injuries. بالنسبة للprevention, we can use the hepatitis B immunoglobulin used to protect persons who are exposed to hepatitis B, especially if given within 48 hours of the incident. To prevent the perinatal transmission of hepatitis B virus. يعني if I have a mother with hepatitis B virus infection, so how we prevent the transmission to her baby? So for the baby, we give both the hepatitis B virus vaccine, first dose, and the HBIG or hepatitis B immunoglobulin within 12 hours of delivery, and we give it at 2 different sites. يعني نحن عارفين هاي والمفروض اصلا في البرينيتال كير انه على 28 weeks of pregnancy نفحص نحن pregnant lady for hepatitis C virus, hepatitis B virus infection, and if we know that the mother has hepatitis B معناته البيبي تبعها within 12 hours of delivery should get the first dose of hepatitis B virus vaccine and hepatitis B immunoglobulin within 12 hours of delivery. أكيد بنعطيهم at 2 different sites. Okay, لأنه ما بدي أنا الimmunoglobulin to neutralize the vaccine. فممكن أعطي الvaccine at the arm and the immunoglobulin at the leg, for example. طيب الهيباتيتس دلتا فيروس. الهيباتيتس دي فيروس أو دلتا فيروس it's an RNA virus. Characteristically الهيباتيتس دي virus definitely needs الهيباتيتس B virus to survive. ليه؟ لأنه الار ان اي تبعت أو الدلتا أنتيجين أو الار ان اي تبع الدي فيروس وأصلا بتستخدم الهيباتيتس بي سيرفيس أنتيجين كور to protect itself and be able to replicate. معناته ما بصير عندي أنا isolated hepatitis D infection. لازم يكون عندي الهيباتيتس بي فيروس يا co-infection بصير co-infection مع بعض أو super infection يعني مريض already infected with hepatitis B virus عنده chronic hep B بعدين gets infected with hepatitis D virus. Okay. The mode of transmission very similar to hepatitis B, percutaneous exposure or permucosal exposure through sexual behavior. زي ما حكينا في عندي أنا ممكن يصير عندي hepatitis D co-infection يعني hepatitis B with D صار لهم co-infection at the same time. And usually if this happens, it can lead to severe acute disease, but usually self-limited with low risk of chronic infection. بينما super infection هذا معناها المريض already has well established chronic hep B وصار صار hepatitis D infection on top of the chronic hep B. So these patients may present with an acute hepatitis. They can present with decompensation of their chronic liver disease. لأنه already هذا المريض عنده chronic hep B. ضيف عليه hepatitis D infection, it may lead to acute decompensation and chronic infection, and those patients usually develops chronic hepatitis D infection. إذا طلعنا على serology markers للhepatitis B D co-infection معناته they are infected at the same time. Initially after the incubation period the hepatitis B establishes itself فبيكون عندي positive hepatitis B surface antigen. But then hepatitis D virus establishes itself and we can test for it by testing for the hepatitis D virus RNA or by testing for the IgM anti-hepatitis D virus. بس لأنه هذول المرضى usually they may have severe acute disease but usually self-limited and they rarely develop chronic infection. Eventually IgM anti-hepatitis D virus will go down and hepatitis B surface antigen will disappear and they will have positive anti-hepatitis B surface antibody. بينما المرضى اللي بصير عندهم super infection they already have a well-established hepatitis B virus infection. The surface antigen already أصلا موجود. بصير عندهم acute on top of the chronic infection. Acute because of the hepatitis D virus infection. بصير عندهم symptoms, jaundice, elevation بالliver enzymes. وزي ما حكينا هدول المرضى اللي عندهم super infection the likelihood انه يصير عندهم chronic hepatitis D virus infection بيكون كتير اعلى. فمعناته hepatitis D virus RNA will appear and persist and they will have positive total anti-hepatitis D virus. Okay. واكيد surface antigen will remain positive فبصير عندهم chronic infection with both hepatitis B and hepatitis D. طيب مين اللي مركز معاي اللي بيحكي لي كيف ممكن أفرق by doing a serum test how can I differentiate between the co-infection and super infection?
I think بالco-infection بيكون في عندي IgM لبوث الهيباتيتس B والD بس بالسوبر انفكشن بيكون عندي IgG للهيباتيتس B و IgM للهيباتيتس D.
في السوبر انفكشن في السوبر انفكشن في الكو انفكشن بيكون عندي ايش عيديها مره ثانيه
بالسوبر انفكشن لانهم الاثنين مع بعض فبيكون في عندي IgM لبوث الهيباتيتس D والD. بس بالسوبر انفكشن بيكون الIgG للهيباتيتس B وIgM للهيباتيتس D. بس بالكو انفكشن بيكون both الIgM للهيباتيتس D والهيباتيتس B.
تمام. فهو في الكو انفكشن لانه صار الاكيوت انفكشن with both of them حيكون عندي البوزيتيف IgM للانتي هيباتيتس بي كور انتي بودي صح؟ بوزيتيف انتي هيباتيتس بي كور IgM بيكون بوزيتيف في الكو انفكشن لانه the infection is happening acutely for both of them together. بينما في السوبر انفكشن لانه اوريدي المريض established hepatitis B من زمان صار عندي الIgM hepatitis B core positive وصار negative وصار عندي الهيباتيتس B core antibody positive. So to differentiate between them هو basically الIgM anti-hepatitis B core IgM anti-hepatitis B core. هون نحن ملخصينها بالسوبر انفكشن والكو انفكشن. كو انفكشن هذا المريض رح يكون عنده positive surface antigen positive hepatitis B virus DNA positive IgM anti-hepatitis B core لأنه the patient is getting infected with hepatitis B now so the IgM anti-hepatitis B core antibody will be positive in that patient. بينما بالسوبر infection the IgM anti-hepatitis B core antibody will be negative لأنه هذا المريض من زمان عنده الهيباتيتس بي، زمان طلع له الاي جي ام هيباتيتس بي كور، صار بوزيتيف نيجاتيف من زمان. اوكي تمام. treatment of hepatitis D hepatitis B infection. pegylated interferon alpha is في المرضى اللي عندهم co-infection أو super infection. إذا في مريض عنده hepatitis D virus, we use the pegylated interferon, and it's better than the conventional interferon. Well, the duration of treatment is 48 to 72 weeks. النيوكليوتايد أو nucleoside analogs اللي حكينا عنهم في الكرونيك هيب بي متذكرينهم تينوفافير والانتيكافير, they are not effective in the treatment of hepatitis D virus infection. So in these cases we use pegylated interferon alpha. البريفنشن نفس البريفنشن اللي بستخدمه للهيباتيتس B بستخدمه للهيباتيتس D, because if I prevent an infection with hepatitis B, then I'm preventing an infection with hepatitis D. تمام. نحن مش مطولين، يعني المرحلة الصعبة من المحاضرة اللي هي كانت الهيباتيتس بي والدي والسيرولوجي والفيزز. الباقي بس نحكي على الهيباتيتس سي والإي. and I think we will be done within the next 10 minutes. Okay. الهيباتيتس C, it's a single-stranded RNA virus from the Flaviviridae family. It has 6 major genotypes. احيانا نحن بنحب نتفلسف على الطلاب او المقيمين نسالهم الهيباتيتس سي فيروس how many genotypes does it have? It has 6 genotypes. وهاي الجينوتايبس لها اهميه في what kind of treatment you give. بس حاليا نحن we are very advanced in the treatment of hepatitis C virus that recently انا بحكي يعني within the last 4 or 5 years, 4 years, we were able to develop new medications for the hepatitis C virus, oral medications that are pan-genotypic. إيش يعني pan-genotypic؟ يعني regardless of the type of genotype, these medications are very effective. And this is a major outbreak in the treatment of hepatitis C. زمان كان treatment لهepatitis C it was very difficult. المرضى يمشوا على medications اسمهم الانترفيرون مع الرايبافارين. They have a lot of side effects with chance of response to the treatment. كانت يعني at best 50 ل 60 or 70%. وكثير من المرضى they are not able or were not able to tolerate the medications. حاليا we have oral medications, we call them DAAs, direct acting antivirals. حبة باخذها المريض. هاي الحبة بالعادة فيها 2 types of medications or medicines. They take it for 3 months. Rate of treatment or resolution of the hepatitis C virus is over 95%. لاحظوا أنا هون حكيت treatment or recovery or total cure, لأنه الهيباتيتس C virus can be totally cured. يعني متى ما تخلصت منه خلص انساه، ولو المريض صار immunosuppressed ولو ماشي على كيموثيرابي، ما دام you are treated and you were responded to treatment, you don't have the risk of reactivation. مش زي الهيباتيتس B virus. Part of that, لأنه الهيباتيتس C virus it's an RNA virus, and this is a schematic presentation of the RNA which encodes both structural proteins that form the envelope protein of the hepatitis C virus, in addition to non-structural proteins such as polymerases and proteases. Mode of transmission could be through percutaneous exposure, sexual contact. Perinatal exposure is also one of the risks for transmitting the hepatitis C virus. هذا السلايد يعني مهم لكم كطلاب، خاصة في لما تشوفوا مرضى عندهم hepatitis virus B or C تسألوهم على risk factors for transmission. Injection drug use, tattoo placement, previous history of transfusion or previous history of transplants. Are you on hemodialysis? Have you had any accidental injuries with needles or sharps? Sexual exposure لازم نسأل على high risk behavior, or birth to hepatitis C virus infected mothers. السلايد كتير مهمة لأنه في حالات الأوسكي مثلا إذا جبنا لكم أوسكي ل abnormal liver enzymes وطلعت الكيس viral hepatitis, so لازم تسألوا على high risk factors. Okay. نحن هون unfortunately one of the ways for transmitting hepatitis C virus في الأردن يعني بنسأل على high risk factors بطلع negative. Unfortunately one of the ways is through dental work. يعني إذا أطباء الأسنان فعلا ما بيستخدموا very good sanitation وhygiene sterilization for their equipment, يعني they can be a major source for transmitting hepatitis B or C. وإجاني كذا مريض infected with hepatitis C virus, and the only mode of transmission that I can think of إنه المريض مساوي major dental work و a lot of bleeding that happened a year or 2 years before they presented to my clinic. فهون ندير بالنا نختار فعلا أطباء أسنان كويسين, good clinics with good sterilization. Clinical features for hepatitis C. والشباب طبعا يعني بدكم تديروا بالكم لما تروحوا عند الحلاق, يعني انه الحلاق يستخدم موس جديد, شفرة جديدة, جدا جدا مهم. والصبايا كمان صالونات التجميل كمان يكون يعني good places to try and prevent any risk of transmission through that ways. Incubation period for hepatitis C average 6 to 7 weeks, but it can range anywhere from 2 to 26 weeks. بالنسبة للهepatitis C virus, the risk of having symptomatic infection is 30% or 30 to 40%, and the risk of developing a chronic hepatitis C is 70%. Okay, فتذكروا, as an adult, if you get infected with hepatitis B, most likely you'll be symptomatic, less likely you'll have a chronic infection, less than 90%. بينما في الهepatitis C بالعكس, if you get infected as an adult with hepatitis C, غالبا معظم هدول المرضى will not have symptomatic infection, and around 70% will develop chronic hepatitis C virus infection. Serology markers that hepatitis C virus, you get infected after the incubation period, the hepatitis C virus RNA will appear. Around 30% will have symptoms, elevation in liver enzymes. Eventually, most of these patients, 70% will develop chronic infection. ممكن liver enzymes تنزل شوي عن acute stage. And these patients, the hepatitis C virus RNA will persist. هدول المرضى اللي صار عندهم chronic infection. And the anti-hepatitis C virus antibody will be positive. Okay. هلا المرضى اللي عندهم acute infection and they resolve, hepatitis C virus RNA will go down, will be negative, بس الانتي hepatitis C virus antibody will remain positive. عشان هيك احنا بنستخدم الانتي hepatitis C virus antibody as a screening test. as a screening test. بس مشكلته, if it is positive, it does not differentiate whether the patient has active infection now or had a previous infection. فعشان هيك هدول المرضى اللي بيكون عندي suspicion انه عندهم hepatitis C, I use it, we order an anti-hepatitis C virus antibody. If it is positive, it means either the patient has active infection now or had a previous infection and resolved. كيف بدي أفرق بيناتهم? By testing for the hepatitis C virus RNA. If the RNA is positive, it means that the patient has an active infection now, and we go ahead and treat these patients. While if the RNA is negative, it indicates that the patient had a previous infection with the hepatitis C virus. طب يا دكتور طارق, why don't we ask to test for the hepatitis C virus RNA in all our patients? Because the anti-hepatitis C virus antibody is much cheaper, so with a very good high sensitivity. So cheap test, so it's much more cost effective to test for it. Diagnosis, as we said, hepatitis C virus antibody, it's an ELISA immunoassay detectable at 4 to 8 weeks after infection, used as a screening test, positive with any history of hepatitis C virus infection, whether active or resolved. بينما hepatitis C virus RNA, and we can test it either qualitative or quantitative, it's positive within 1 to 3 weeks of acute infection, and it indicates active viremia. حتى أحيانا يعني بعض المرضى اللي هم جايين هذا high risk behavior, هذا needle stick injury, and they are coming because they are worried about the possibility of diagnosis and the possibility of having Hep C infection, and they are coming within that incubation period. هذول المرضى ممكن نشيك عندهم الهيب سي RNA, لأنه ال RNA becomes positive much faster than the Hep C antibody. As we said, patients who have an acute infection, 70% will develop chronic infection. around 20% of patients who will have chronic hep C infection will eventually develop cirrhosis. And if they develop cirrhosis, there is a risk of hepatocellular carcinoma. Also, there is a risk of hepatic decompensation from the cirrhosis complications. هدول الميديكيشنز حكينا عنهم، يعني اكيد مش مطلوب منكم تحفظوا اسماء هاي الميديكيشنز، مش رح نسالكم عن الميديكيشنز فور hepatitis C، بس اعرفوا انه now we are very advanced in the treatment of hepatitis C virus. We are using these DEAs, direct acting antivirals. معظم هدول الانتيفيرالز they are a combination of two medicines that work on the non-structural aspects of the hepatitis C virus. ففي عندنا medications that work on the NS3/4A protease inhibitors, medications that work on the NS5A inhibitors, medications that work on the NS5B polymerase inhibitors, and هلا بتفننوا في الاندستري, so they combine one of these medications to one of these medications to come with a medicine that's given one tablet, usually for 3 months, and the chance of treating hepatitis C virus is over 95%. Prevention of hepatitis C, أكيد screening blood, organ and tissue donors for hepatitis C virus infection, and high-risk behavior modification, and definitely precautions regarding body and blood and body fluid exposure. يعني دائما هدول المرضى بنحكي لهم if you have a cut, if you have a wound, make sure that you cover it from the rest of your family members so these members are not exposed to your blood or body fluids. آخر إشي hepatitis E virus. The hepatitis E virus is a small RNA virus of the Hep viridae family. The mode of transmission similar to the hepatitis A virus, to fecal-oral transmission. Incubation period average 40 days, but can range anywhere from 15 to 60 days. Case fatality rate, overall risk of having acute liver failure secondary to hepatitis E virus leading to death is less than 3%, 1 to 3%. وين الimportance تبعته؟ إنه والله if the hepatitis E virus infects a pregnant woman or pregnant woman, لأنه risk of having acute liver failure and death if the hepatitis E virus infects a pregnant woman is much, much higher. It's around 15 to 25%. فهون جاي الأهمية for testing for hepatitis E virus, especially if you have a patient who is pregnant and that patient comes with elevated liver enzymes, then we need to test for hepatitis E virus infection. خاصة إنه risk of acute liver failure or mortality is much higher in pregnant women compared to to the rest of population. Okay, fecal-oral transmission حكينا عنه. Highest attack rates is among young adults aged 15 to 40 years with relative sparing of children. Okay, high mortality rate 15 to 25% in pregnant women, especially in the third trimester. السيرولوجي كتير قريب للهيباتيتس A virus serology. We will find the hepatitis E virus RNA in the stool. The patient will become symptomatic, elevation بالliver enzymes. في initial stage, I can detect the IgM anti-hepatitis E virus. Eventually, most of these patients will recover, so IgM will be negative, and the patient will have positive IgG anti-hepatitis E virus, indicating previous infection. Treatment, usually hepatitis E virus infection is self-limited, and the treatment is supportive care, very similar to the hepatitis A virus. Prevention, avoiding drinking water of unknown purity, لأنه hepatitis E may affect water or food that's contaminated. وندير بالنا يعني الحمد لله hepatitis E virus is not common in Jordan, but it's much more common in Southeast Asia, خاصة مثلا Indian continent. Okay, والشغله مش انه والله ندير بالنا مش انه والله بس نشرب bottled water. حتى لو رحنا على مطعم using ice cubes, هاي ice cubes that you use it for the beverages can be infected with hepatitis E virus. Okay, and now we are in the process to try and develop vaccine for the hepatitis E virus like the hepatitis A virus. بهيك نكون خلصنا المحاضرة. في أي أسئلة على أنا عارف هاي المحاضرة طويلة. There is a lot of information. يعني تغدوا تعشوا هلا خذوا راحتكم بعدين go back through these slides and try to study it today, just لأنه أسهل تحفظوها بعد الكلام اللي حكيته اليوم، إنه to come back later for it. إذا في عندكم أي أسئلة يعني بتلاقوني في الكلينيك يوم الثلاثاء في الجي اي كلينيك أو في الاندوسكوبي. I'm welcoming any questions.
دكتور ممكن أسألك؟
تفضلي.
في إشي ما فهمته، حكيت إنه الهيباتيتس سي كان بي completely cured على عكس الهيباتيتس بي، إنه في حال نزلت المناعة الهيباتيتس بي بيصير له reactivation. هذا الحكي بيصير بالكرونيك انفكشن للهيباتيتس بي يعني؟
في الكرونيك او حتى المرضى اللي هلا كرونيك انفكشن اصلا كرونيك انفكشن السيرفيس انتيجين از بريزنت and it is active. يعني هدول المرضى اذا انا بعرف مريض عنده كرونيك انفكشن، مش حكينا نحن البيست بيريودز فور تريتمنت اذا كان اميون اكتيف او ري اكتيفيشن. بس هذا المريض اللي عنده كرونيك انفكشن بده يمشي على كيموثيرابي، اكيد بدي احطه على بروفيلاكسس لانه اصلا عنده الهيباتيتس بي اكتيف موجود بالبلد والسيرفيس انتيجين از ديتكتد ان ذا بلد. تمام. بس هذا مريضي اللي صار عنده acute infection وريزولفد والسيرفيس انتيجين عنده نيجاتيف. تمام. بس انا حكيت لسه صح سيرفيس انتيجين از نيجاتيف لانه هذا التست موجود في السيرم، بس المشكله انه هذا الدي ان اي تبع الهيباتيتس بي از اوريدي انكوربوريتد بالهيباتوسايتس تبعت الليفر and I cannot detect it بالسيرم. هذا المريض بستنى انه الاميونو او الهيباتيتس بي بستنى انه المريض يصير اميونو ديفيشنت او يمشي على كيموثيرابي قوي to be reactivated. اوكي.
تمام دكتور. يعني those who had been infected بالهيباتيتس بي حتى لو كان acute عندهم more risk لرياكتيفيشن.
بالضبط. بينما الهيباتيتس سي سواء كان عنده acute هيب سي وصار ريزوليوشن او كان مريض عنده كرونيك انفكشن وتريتد وصار الهيباتيتس سي فيروس ار ان اي نيجاتيف. تمام. هذا ما دام صار الار ان اي عنده نيجاتيف معناته he is treated for life. خلص I don't worry about it.
تمام دكتور، شكرا.
فحاليا يعني اسهل على المريض او اسهل يعني if you have to choose whether to be infected with hep B or C طبعا راح تشوز hepatitis C infection. ليه؟ لانه we have good medications for it and if these medications are effective and they are very effective you don't have to worry about وخلص انا صار الهيب سي ار ان اي عندي نيجاتيف I know that I'm treated for hep C for the rest of my life.
دكتور ممكن سؤال؟
تفضلي.
هلا كيف ممكن أفرق بين بيشنت جاي بأكيوت هيباتيتس بي أو إنه يكون بالفاز الثانية بالكرونيك هيباتيتس بي يعني بالإميون أكتيف؟ بقدر أفرق؟
بفرق بيناتهم عن طريق الاي جي ام انتي هيباتيتس بي كور. اذا الاي جي ام انتي هيباتيتس بي كور انتي بودي از بوزيتيف معناته انا بالاكيوت انفكشن. اذا الاي جي ام انتي هيباتيتس بي كور نيجاتيف معناته لايكلي ام في الكرونيك انفكشن.